Today I'll be showing you how to perform a trauma assessment. So basically an assessment on anyone who may have gotten hit by a car or fell off a ladder or sustained any injury from external forces basically. So the first part is when you first arrive on scene, there's an acronym PENMAN to help you remember it. And this is what you do before you even initiate any contact with the patient. So first is PPE, which stands for personal protective equipment. This is basically latex gloves or masks or anything that you need to protect yourself from potential contamination. E is environmental hazards. So basically if the car is on fire in a car crash or something like that, then you're not going to approach it. You're going to wait for the fire department or other properly trained personnel. Number of patients you have to determine in case you have to prioritize them and in case you need any more help with anything. Mechanism of injury, which is what happened to cause injury to the patient. So for our car crash example, it'll be a motor vehicle accident. The A in PENMAN stands for any additional personnel. So if you need more people because you have too many patients, or if you need training that is outside of your training, then you're going to call for more assistance, such as paramedics who have more life-sustaining strategies. And then the N in PENMAN is need for C-spine, which stands for cervical spine, which basically means you're going to stabilize their head and neck to prevent any damage to their spine, or a need for extrication, which is basically just if they have to get out of the car quickly or non-quickly, then you have to make a mental note of that in your head. You don't necessarily perform these things. It's just what should naturally come to your head when you're arriving on scene and you're trying to figure out what's going on. Okay, and then after that, you form your general impression, which basically is it's an automatic thing in your head that you state whether or not the patient is doing well in your opinion when you first arrive. So if they're walking around, then that's a pretty good impression, but if they're unconscious, that would be bad. And a lot of your treatment depends on the general impression. And then after that, that leads into your level of consciousness, which is another acronym, which is AVPU to determine it. If they're A, alert, then their eyes are already open and they're already conscious. V is verbal, meaning they wake up or respond to verbal command. P is pain, meaning they wake up or respond to painful stimulus, so maybe a sternum rub. And then U would be if they're unresponsive or unconscious at all. As it progresses down, it gets progressively worse, obviously, so alert is the best. So if they are alert or if they become alert, you ask them person, place, time, event questions to see how well their mental capabilities are. So person is, what's your name? Place is, where are we right now? Time is about what time of day, so maybe morning or afternoon. And then event is what happened, what's happening now, or what happened just a second ago in the incident. These are all very basic questions designed so that anyone can answer them unless their brain has sustained some sort of damage. And then if they answer all of them, they're alert and oriented times 4. Alert, oriented times 4. And then after that, you get their chief complaint, or if they're unconscious, their apparent life threat, which means chief complaint is whatever they tell you hurts. So if they have a broken leg, they're going to tell you that their leg hurts a lot. But also life threats, you have to perform what's called a rapid scan to make sure there's nothing else wrong. Because if their leg hurts, if their leg hurts a lot, like from a femur fracture, they might disregard other pain, such as chest pain, which can impede their breathing. So you perform a rapid scan, meaning you look at their whole body real quick in about 30 seconds or so to see if there are any more bleeding or any more life-threatening injuries that need immediate attention. Next is what's called the ABCs. So that stands for airway, breathing, and circulation. Anyone who's taken a basic CPR class knows this acronym, and it's the primary duty of any emergency responders to make sure that their airway is adequate open, which is called clear, open, and maintainable. Breathing is not compromised so that their lungs can fully contract and expand. And then circulation, meaning that their heart and blood is circulating effectively. And this goes in order of priority. So airways first, and then breathing, and then circulation is the last priority. So we want to make sure that air can actually get through the airway, and then there's nothing clogging anything past what's called the pharynx, where the nose and the mouth kind of airway meet. Anything past that will impede air getting into the lungs, and that's your number one priority. Breathing. You want to make sure that there's no injury that messes up their breathing. So if there's like a rod sticking out of their chest, you want to make sure that their lungs are able to expand and contract with your help or without your help. Without your help is preferable. And then circulation is you want to make sure their heart is beating and that their organs are getting enough blood and oxygen and all that. So these are your number one concerns, and they must be maintained at all times, and that's your primary objective of the situation. After that is treatment and transport priority. You're going to immediately transport them if any of the ABCs is compromised, because they are very close to death, that means. So they are a high priority, and you're going to get them out of the scene as soon as possible. The end. Thank you.